Hey there, Dr. Ben again with Oakland Physical Therapy with this week's voted on video request. Has to do with having neck pain. When you really don't have a neck problem, you've got a mild shoulder problem. Okay, so disclaimers. If you have significant shoulder pain or neck pain, you should always seek the advice of a medical professional. The things I'm going to teach you, they shouldn't cause you any additional harm if you have a shoulder issue. If you can't do them, that would be a good indication that you should seek the help of a medical professional. Okay? Not meant to cure you here, meant to just help you out if you have basic or kind of rudimentary neck pain from a mild shoulder issue. Okay, so first of all, let's talk about why that may happen. So, a lot of times what people have is they get pain when they rotate their head and they think they have a neck problem, when really what's tight is typically a muscle that runs from the outside of your cervical spine or neck down to the top of your shoulder blade right here. And usually you'll have a tender spot right there. People complain about tenderness there all the time. We do a variety of techniques and treatment to help with that, including dry needling or focused massage or myofascial release techniques. If you don't know what those mean, you can Google that. All right, but that's the main problem. And usually for most people that think they have a neck problem when they really have a shoulder problem, it hurts when they turn their head to the side of that shoulder. So they may not even know they have a shoulder problem on that side, but they're usually tender around that spot on that side. Okay, so the problem is that whenever you're using your arm, either your rotator cuff is weak or you've just developed a bad habit or you're just really tense and keep your shoulders shrugged, is that when you reach with your arm, your shoulder blade moves up, kind of how I'm moving mine right now, instead of it dropping down and out like that. So one of the very simple exercises we teach people to do is you got to teach yourself to move correctly. So we call it disco dancing. You get bonus points if you kick your hips when you do it, but you really just have to move your arm. Doing it with your arm looks like so. And you take your other hand, 2 fingers, put them at the top of your shoulder right here. And whenever you point, so you can see how I'm got my arm straight, pointing a finger. Get all that? Arm straight, pointing a finger. And then I'm pointing away from myself along the same line that my arm is on. Where these 2 fingers are touching right here, that shouldn't get harder. That should get softer when you reach away from yourself. Okay, that means you're moving your shoulder blade how you need to in order to get rid of some of that neck problem. The other thing you can do is just reach up and shrug towards the ceiling. Okay, none of this should hurt. It should help get this muscle to relax. There's a lot of reasons someone can get neck tightness from a shoulder problem. We're just picking the primary one. Okay, so those are a couple things you can do. I recommend doing them in groups of 15 to 20. You're just practicing it. If your arm feels really heavy and tired, that might be a sign of weakness or rotator cuff weakness. Maybe you should see somebody. Okay, here's the other exercise. Pull out with your hands. Gently pull out, just like so. You should feel muscles working right here on the back side of your shoulder. Okay? Exercise number 3. Also very simple. Okay? Gently pull out. Put this at your nose. And then go up and down. Okay? You'll notice when you do this is that we're trying to get you to use these muscles right here on your shoulder blade, and that your shoulder blade swings out. So when you reach up, your shoulder blade shouldn't shrug towards your neck. It should go out around your rib cage. So shoulder blade shouldn't shrug towards your neck. It should wrap around out towards your rib cage this way. Right here should get soft as you get to the top of your reach, or if you're doing this exercise when you point away. And those exercises may help you if you have a mild shoulder issue that's showing itself as a neck problem. Your neck's getting stiff. If you have any questions, if you need to seek consultation, again, if that didn't help you, seek consultation with a medical professional. We'd be more than happy to help you at Oakland Physical Therapy. And again, if it's more severe than those simple exercises, there's a variety of things that can be done for you. Thanks.